have been receiving a lot of your questions related to COVID-19 as the new plans were just unveiled to reopen the state.
All right, so we've been asked to send your questions in for Governor Chris Sununu. He is now joining us live on set tonight.
We are all social distancing, so is the governor, the crew wearing their masks. We want to get right to the questions. So first of all, good evening, Governor, and thank you so much for joining us. First, can you briefly, I know it might be difficult, take us through today's big decisions?
Yeah, so I mean, it was about an hour and a half presentation. I think the big decisions today are letting the folks know in New Hampshire how we're using data to make the decisions we are, the decreasing number of % positive cases that we're seeing, as well as the increased testing capability that the state has, and then looking at things like hospitals to reopen some additional elective surgeries, barbers and salons just for cuts and some limited colorings. Golf, making sure that can be open in a very safe way, but again, only for New Hampshire residents. Keeping our campgrounds open, also just for New Hampshire residents. And starting the first phase of expanding restaurants and with allowing them to go from takeout to now doing some outdoor seating options as well.
Let's talk a little bit about those retail businesses. What's being done to help them reopen slowly?
So we are going to let retail businesses open. We're making a couple stipulations. We have these new universal guidelines that we want them to adhere to. One is making sure that those that are interacting with customers are wearing a cloth or face covering at all time, making sure there's certain sanitary procedures, making sure they're limiting the number of people in the stores to about 50% of normal capacity, or at least if there has to be a line outside, they're lining them up with good physical distancing there. So it's just kind of the practical stuff that we've put into place for grocery stores and other businesses that are currently operating, but making sure that we're extending that out into a lot of these retail opportunities as well.
One of the top questions we got was about DMVs. Melissa asking, when will the DMV reopen to allow testing for new licenses? So
part of today also, we didn't talk about too much at the press conference, but part of today is also about a 2 or 3 phased approach in opening the DMV. So check in with the DMV website. We're going to start expanding the actual locations that are open for in-person transactions that have to happen. Some of that deals with everything from CDL licenses to driver's licenses, all the different aspects. So we are flexing all those open in a 2 or 3 phased approach as well.
Okay, Don has another common question that we received saying, I work in a dental office and nothing was mentioned about opening them up. When are they expected to be able to see patients for their regular hygiene appointments and appointments other than emergencies?
So we looked really carefully at dentists. So we've had a task force. Let's take it one step back. We've had a task force with legislators on it, but in a bipartisan way, stakeholders. It's all open in public meetings and people can come and actually dial in to hear the meetings and everyone gets to present. Dentists are one of the most challenging areas because again, dental work is so invasive with the mouth, with saliva, with aspiration and things of that. So even when you put a lot of the PPE that we have available, we still couldn't quite get there with the Department of Public Health in ensuring the safety of not just the patients, but the dental hygienists and the dentists themselves. So we're trying very, very hard and we think we're going to get there, but we're just not there yet. It's going to take a little more work.
Here's a question from Johnny asking, will eye care specialists be reopening?
Eye care specialists, I guess the question is like for ophthalmologists and optometrists. So I guess if they came under the eye care, if you're just getting eyeglasses, that would be under retail. And if you're getting more like an eye surgery or something like that, or something actually done to your eyes themselves, that would be under healthcare. So both of those are allowed to flex open.
All right, thank you so much, Governor. Stay with us. We will be back with more of your questions right after this.